Senator Lindsey Graham of South Carolina. He strongly opposes the health care bill. Senator Graham, good morning.
Good morning.
Now, Republicans have been accused of opposing health care reform in an effort to win bipartisan battle over Democrats and also the president. How do you explain that not one single Republican is prepared to vote in favor of this bill, Senator?
How many people today are covered under government-run health care? Do you know, Ann? I don't mean to be cute here, but 60% of the American people are in some form of government-run health care. If the bill becomes law, it's 80%. No Republican is going to vote for a single-payer system. This takes the system toward the European model. I've been a Republican who's worked with Democrats on tough issues. Olympia Snowe is a moderate Republican from Maine who voted for the bill in committee, but rejected the bill when it came out of committee because it raises taxes and it cuts Medicare and it expands the role of government. That's
so
the
are you suggesting,
difference.
do you agree then with the chairman of your party, that Michael Steele, that basically the Democrats are flipping the bird at the American people?
Well, here's what I think our Democratic colleagues want. They want a bill no matter what's in it. To get the 60th vote, they drag Ben Nelson into a room, not on C-SPAN to negotiate. We don't even know where the room was at. And they cut a deal with him saying, we're going to expand Medicaid to cover more Americans in a government-run health care, but when it comes to Nebraska, the federal government will pick up your share. Now, my state, with 30% African-American citizens, a lot of low-income people in South Carolina, it's going to cost my state $1 billion. That's the same old stuff that I object to.
You go
That's
so
not
far as to
change
calling
we can believe in. That's sleazy.
You go so far as to call this Chicagostyle politics.
Yes,
bribes, you use the word bribes, but critics have pointed out that these deals would not even be necessary if Republicans like you weren't so determined to filibuster every vote. Newsweek's Ben Adler says you are to blame, saying if Graham and any of his colleagues chose to behave like a legislator elected to govern rather than as a political operative seeking advantage in the 2010 midterms, he could vote against the bill itself. That's what senators used to do. What is your reaction to that, Senator?
The only way we could stop this bill from becoming law is to stand united against expanding the role of government. The reason no Republican is going to vote for this bill is because when it's over, 80% of the country will be in government-run health care, and the 20% who have private health care today are eventually going to have their premiums go up because there are not enough people left in the private market.
Do you agree that it was your efforts, in fact, that created the situation that required? You don't agree with that?
No, I believe that I was doing what I should be doing as a member of the Senate. I've worked with Ted Kennedy to solve the immigration problem. I voted for Sotomayor. I was in the gang of 14 that stopped the filibuster. I'm not a member of a militia. I'm not a birther. I'm a senator who wants to reform health care, but I'm not going to allow my country to become a socialized nation when it comes to health care. I'm not going to sit on the sidelines and watch taxes go up $518 billion and $470 billion be taken out of Medicare when it's on its knees. That's not bipartisanship.
Last question, yes or no answer. Is there any doubt in your mind that the president will have a bill signed before his State of the Union address?
There's a lot of doubt in my mind. The more you know about this, the less people like it.
More than a yes or no, but we got your point. Senator Lindsey Graham, thanks so much. It is now 7:08. Now here's Meredith.
And thank you very much. And now to what could be